Good morning. This is Baton Rouge Labor Radio coming to you on TQT 106.1 FM. This program is brought to you by the Louisiana AFL-CIO and the Baton Rouge Building and Construction Trades. My name is Julie Cherry, and I work for the AFL-CIO as the Secretary-Treasurer, and it is my pleasure to be with you this morning. You've been listening to Charles Showalter with the Union Edge, brought to us by Workers Independent News, and we thank them for that programming. We appreciate you listening this morning. That began a little bit late. I'm sorry to our regular listeners. I had a little bit of low-tech difficulty. Our call-in number here is 343-1075, and this is Talk Radio, and I'd love this to be a conversation. This is the first time that I am doing this solo, and so I have to thank Neil Miller for my training. If something goes well, I'm going to give him credit. If it goes poorly, then I'm going to fuss at him. So here we are today with local news, local and state news, and I had to think about what I wanted to talk about this morning, and I think since some of you who are watching the local news would have seen some of the joint legislative committee on the budget and another round of mid-year cuts that we have to make and the financial difficulties the state is in, and that locally the closure of the emergency room at the Baton Rouge General Hospital is a very, very hot topic. That's the one I really want to talk about. I want to talk about the closure of an emergency room and what that means to this community. This hits me very personally. That is the emergency room that's closest to where I live, to where many of you live. And there are a lot of trees in this forest. There are a lot of reasons that this is happening. But I want to make it clear from the get-go that I am not criticizing the management of the Baton Rouge General Hospital or the agreement between the state, LSU, and Lady of the Lake for managing charity systems. What I want to question is the direction this state is moving in, that we have a major emergency room closing. And I think that has everything to do with the financial practices of this state and being maybe penny wise and pound foolish, as the saying goes. So for a lot of reasons this is happening. I brought in a couple of newspaper articles. One thing that the listener needs to understand about emergency rooms is, by federal law, emergency rooms may not turn patients away. Period. Can't do it. It is against the law, and if you present in an emergency room, you will be treated, whether or not your problem is an emergency. Now, certainly some people seek care in the emergency room who could be cared for elsewhere, but that means you have to have access to other kinds of services, urgent care services. Like I said, it's a pretty complicated picture. So, in general, every emergency room must accept patients who come in, whether they have private insurance, whether they have Medicaid, or whether they are self-pay or uninsured. Remember that everyone who's uninsured isn't necessarily unable to pay. There are some folks who maybe have more money than most of us who choose to pay for everything themselves and not go the insurance route. But a lot of people who are uninsured because they can't afford insurance and they don't qualify for Medicaid. So you go to an emergency room for treatment and you get treated whether or not you can pay. So the emergency room of almost every hospital will generally lose money. That's my belief. It's an opinion. I don't have anything to back that up, because they have to accept uninsured and non-paying patients. So the rest of the hospital operations have to make up for that loss, and that is true whether it's a not-for-profit hospital or a for-profit hospital. So mostly hospitals, non-profit hospitals, they strive to break even. But if they're losing money there that they're not making up for in the rest of the hospital, then something has to happen, because no business can continue to operate at a loss. I read in the paper that before the closure of Earl K. Long, the Baton Rouge General Emergency Room was losing about $6 or $7 million a year. That's an incredible amount of money to me. But they were making it under the scenario where Earl K. Long was open. Once Earl K. Long closed, that figure skyrocketed to about $12 to $13 million, and currently it is running, I think, around $2 million a month, which is twice that. So in 2 years, it's roughly doubled the first year and doubled the second year. To their credit, the general told the community, told the state back in the fall that they were going to have to close within 60 days unless something happened. And the state did come up with some emergency funding, and that was supposed to be really a stopgap measure as other things were considered, and nothing else apparently has materialized over that period of time. And so the general has once again announced that within 60 days they would have to close the emergency room. Now, everybody's all up in arms over that, and I think rightly so. The region nearest the general is now being referred to as a death zone. Some say the Jindal death zone. Even the emergency medical services have announced that this will result in longer transport times. You have to understand, when an ambulance comes to pick you up, the norm is that you go to the nearest facility from wherever you are picked up by emergency services that can treat you, and if you are diverted from an emergency room because that one is full, then it will be the next closest one, and so forth. So emergency medical services has said that this is going to result in longer transport times for those patients who are really critically in need of emergency services. We're talking about heart attacks. We're talking about strokes. We're talking about major trauma victims, whether it's a burn victim or a shooting victim or someone in a car accident, that type of thing. Not somebody who needs to go in and have a broken bone set or have a few stitches done, but trauma. Now you need to remember that in those situations, often seconds and minutes count, the treatment for those types of things, and it will make a difference not only in the survival rate, but in the degree of recovery that someone is able to make. So now we have a whole region where we've closed an emergency room, and the next closest one for most people is either going to be the lake on Essen or the General at Bluebonnet. Remember that we also have Lane Memorial way up in the northern part of the parish, and we have Oxner Medical out on O'Neill Lane, the very eastern part of the parish. So some of the things that are happening to take up for this gap are the expansion of urgent care clinics, like the one on Airline Highway that LSU operates very, very close to where Earl K. Long was. And then LSU recently started operating an urgent care facility on North Foster, and I believe that's the old Stanicola Medical at North Foster and Greenwell Springs / Gus Young. Now, one of the things that has been announced is that they're going to have the expansion of hours at that clinic. So the state is working to address this issue. The state, LSU, Our Lady of the Lake, and all those entities that are operating these facilities. Now, the General's been treating about 45,000 emergency patients per year. And I think since Earl K. Long has closed, the lake has announced they're treating about 105 to 110,000 emergency room patients per year. So that's a lot of emergencies just at those two facilities. And remember that these facilities serve the region and not just Baton Rouge and the neighborhoods surrounding them. In my opinion, we did some very short-sighted things financially that have caused this. Every emergency room is going to need some financial support from the rest of the hospital and from the community. When we signed the cooperative endeavor agreements between the lake and LSU and the state, we made a nice deal for Lady of the Lake where they would get 100% Medicaid reimbursement on those emergency room patients. Medicaid doesn't necessarily cover all costs, but it will take care of the uninsured, even though it is insurance. In the meantime, we made no provision for the other hospitals to recover for those patients. And with the Affordable Care Act, which I personally believe is also a step in the right direction, some of the other funding for uncompensated care has gone down. So the hospitals took a double whammy, if you will, in that they still have to take these uninsured patients, but they're losing other federal funds to help pay for a larger program. What do you have to say about this? I'd love to hear your opinion. The call-in number is 343-1075. I believe this community can do something to get together and get the state to reconsider what we've done. I think Medicaid expansion is still on the table. Medicaid expansion would take care of a lot of those folks who are uninsured, who simply can't afford insurance, but they're not poor enough for Medicaid under the current program. That brings to mind another article that was in the paper this week that kind of goes hand in hand with this. And it talked about how many Louisianans are enrolled in so-called Obamacare, the proper name of which is the Affordable Care Act. Our participation rose by 81% in this second year. Remember, that deadline just closed. And I don't think that's a caller for us. That's 343-1075 is our call-in number. And so this article, which appeared in Thursday's paper of this week, said that it's kind of impossible to hang on, let me see if that is for us. Caller, you're on the air. And evidently not. Okay. Which is good, and they attribute a lot of that success, a lot of the bump in participation to the website working better. The first year there were a lot of kinks in healthcare.gov, and that has been largely worked out. Last year, about 102,000 Louisiana residents bought coverage under the Affordable Care Act. But our uninsured population is about 800,000 people, so the lowering of, so our uninsured rate only went down by about 1.5%. Now, some of those folks already had insurance, but they were able to shop in a different way on the healthcare.gov website and purchased their insurance in that way. New Orleans metro area accounted for more than a third of the state's enrollment, with 62,872 enrollees. And in Baton Rouge, there were 37,154 enrollees, according to the U.S. Department of Health and Human Services. So about 87% of those folks who enrolled that way actually are buying coverage through healthcare.gov, which is the online insurance marketplace. And that's about 160,500 of the consumers in the state. So those calls went up a lot, and those are folks who some were uninsured and some are now insured at better rates. The other thing that needs to be understood about this is a lot of these folks now, about 89% of the Louisiana consumers who signed up as of January 30th qualified for an average tax credit of $322 per month through this federal marketplace. Okay, so many of them got insurance premiums, family premiums, for $100 a month or less. Now, if that's not something that's good for this state, I don't know what is. There are critics of this plan who say that many of these will have deductibles so large that policyholders won't meet them, and the Obamacare or the Affordable Care Act has also drawn fire because expanding coverage to poorer people supposedly forces others to pay more for their coverage, and concerns that the legislation will lead to huge increases in premiums over the next few years. However, I think that in a free market society, what's going to happen is what's supposed to happen, and what I think will take some time to show up, is that those insurance companies are going to have to compete for those premium dollars, and eventually we're going to see that level out and come down. This is already happening in states where Medicaid expansion has been accepted. I want to remind you that a number of governors, Republican governors, have now figured out, okay, this isn't going away and we need to accept this because it's good for our people. I want to also remind people that not everyone who receives Medicaid is unemployed or on other assistance. A lot of times people who receive Medicaid have disabling conditions, or perhaps they work, but they work at jobs that pay them poverty-level wages, which also feeds into the problem here. How long can people keep making it on $7.35 an hour? Can you raise a family on $7.35 an hour? I know that I couldn't. I'm pretty sure I couldn't take care of myself on $7.35 an hour, not without roommates or a spouse or something like that, because the data shows that in the United States, minimum wage isn't enough to have a two-bedroom apartment in any real estate market in the United States. For those who want to object at this point and say that, oh, well, most people work in minimum wage jobs or teenagers with entry-level skills, that simply isn't true. It may have been a generation ago that was strictly for teenagers or young adults to have expendable income, beyond an allowance or whatever. But that's just not true anymore. About 60% of minimum wage earners are adults between the ages of 20 and 64. I want to remind you that those are child-rearing ages. So these are folks who may not be responsible only for themselves, but for a family as well. $7.35 an hour. What does that equate to? In Louisiana, we turned down Medicaid expansion, even though we have about 300,000 citizens who make less than $15,000 a year. I think that's immoral. I think that's part of our hospital problem as well. Everybody gets sick. It doesn't matter if you're rich or poor. Everybody gets sick sometimes, and most of us will have at least one emergency within our lifetimes, or a minor emergency. Maybe it is urgent care. So what are some of the solutions? Again, this is Baton Rouge Labor Radio coming to you on WTQT 106.1 FM. Our call-in number is 343-1075. Baton Rouge Labor Radio also has a Facebook page. We'd love you to like our Facebook page. The Union Edge also has a Facebook page, and that's a place for you to find some more information as well. And we have a lot of local unions all over the state. I think I forgot to mention that this program is also streamed around the state. If you go to the WTQT homepage, I usually do it by Googling WTQT if I want to listen on my computer, and you should be able to follow links to listen live there. So I have given a soliloquy this morning about hospitals, and I'm not used to being here and talking by myself. I'm very disturbed, as I said, by the closure of the emergency room at the Baton Rouge General. I don't think this is a problem of management at the Baton Rouge General. I think it is a problem of how we have decided where we're going to use our state resources, and that no business can stay in business for very long with the kind of losses that emergency room has been sustaining over the last couple of years. Then what are we going to do next? What's going to be the next cuts? I think that's going to be in the news here from April through June. Our legislative session will convene in April. We've got a huge budget gap This year we have to close. That was the topic of discussion at joint budget yesterday, and are expected to have to make big cuts to next year's budget as well. Things have gone wrong. How are we going to fix it? This is a fiscal session. This is a session in which if you want to introduce a tax or a fee, this is the session you can do it. You can only do it in odd-numbered years, in short sessions. It is also the time when we can consider rolling off some tax breaks or tax incentives. And, you know, we think everything needs to be on the table. Bobby Jindal has repeatedly said he's not going to raise any taxes, and he considers taking away a tax break, raising a tax or raising revenue. I think that's misguided thinking. I think we've given breaks on taxes that are on the books. It's uncollected revenue is what it is. It's not raising revenue. It's revenue that we've forgiven. And maybe it's time for some of these folks to pay up. It's part of the big picture. We're giving tax breaks all over the place, and I think we need to take a good look at them and find out what are we paying for, what are we getting with those tax breaks. So your thoughts on that? Our call-in number is 343-1075. And what can we do? What can we do? What are the solutions? I think it's going to take a combination of things to solve these problems. But what can we do? How do we go about it? How do we stem the tide? How do we go back? How do we get back to a situation of prosperity where we're not looking at raising college tuition every year, cutting health care every year? The government is supposed to do some things that that corporations are not supposed to do, and it's supposed to do them in different ways. The government's not there to make a profit. The government is there to provide services in the most efficient way possible. So some thoughts on that. How does the government do that? Yes, we want business in this state. We want good businesses in this state. We want them to bring good jobs to this state. How do we manage that? How do we skirt the line on these things where we know what we're paying for with tax breaks? What do we demand of corporations when we give them a tax break? And I'm trying to see if I can figure something out here. Here we go. That brings to mind. Good morning, caller. You're on the air. Good morning. This is WTQT.
Well, good morning, Julie. How you doing this morning?
I'm doing just fine, Neil. How are you?
I'm doing fine. I just want to tell the listeners that it is a pleasure to have you on the show, doing the show yourself, and I greatly appreciate it. I think it gives the viewers, the listeners, a different view on how, instead of Mike and myself, now we've got a third party that's in the labor movement that sees a lot more than Mike and I do as far as the legislation session goes. And, Julie, the immediate thing, in my opinion, from listening to what you were saying this morning, would be for General to get off of the presidential run and accept the Medicare expansion part.
I have to agree with that, Neil, because it would bring some dollars to this state. And remember that we're already paying those taxes. If we don't take the Medicaid expansion money...
It also bring jobs. If I remember right, reading about that about a year ago, it was by doing that, it would also bring jobs to Louisiana.
Yes, I believe it would bring some health care jobs and some, because more people will have access, we will have more need to treat those folks. That's correct. And then I think there are usually some, non-direct jobs associated with that too, medical supply and all that comes into treating folks. Just like when we have a major plant that opens. You know, those plants, the pump suppliers, the chemical suppliers, the people who run those businesses, the drivers that bring those supplies and things. There are direct and non-direct jobs anytime you expand an industry, and all that's good for the economy. You're absolutely right to bring that up.
And I do agree with you that, you know, his philosophy is if you've been given, if you have been given tax breaks to some of these corporations, and you take them away, that's like adding a tax on. That's the furthest from the truth. Maybe we can scale it down a little bit.
True enough. You know, maybe our corporate...
Not take it completely away. I mean, you know, scale it back a little bit. I'm sure, you know, I was reading in the paper last night about they're opening up a facility in this place, and they have to spend a lot of money to build this facility in central Louisiana, I think. You know, or the central part of Louisiana, and they get like a 6%, or I forget what it was. It's a pretty good chunk of money for a 10-year period of time.
Wow. Yeah.
That's a lot. That's a lot.
Well, and then, you know, it's supposed to be a 10-year tax break here, but yes, I believe so. I still hear you.
Oh, okay. Well, be like what we were talking about yesterday, Julie. Sometimes I think Ken's listening, but she really isn't.
Now, if she says I hear you, but then I am sitting here by the phone, too.
I know it. But, yeah, I just, like I said, I don't understand. Did you read the thing about not only our existing governor, Bobby Jindal, but our governor that did, or a candidate that is running for governor, how often he gets missed voting on important issues in Washington, D.C.
If you're not there, you can't take care of business, can you? Can't do the job.
Two of our main leaders of Louisiana, and we're in this financial crisis right now. They're not doing what they were elected to do.
They're everywhere but here.
Yeah.
Right. That's right.
I think the average was, and I don't want to miss those numbers. I don't want to miss it, but it was 3 times more than what the average was with David Center.
Wow.
His absenteeism as far as voting on important issues.
Yeah. It's
That's a shame.
Yeah. And then when he votes wrong. Come on.
Yeah.
So.
And I mean, it's not that hard to sit there and do what you were elected to do.
Folks, don't be misled.
And the governor's race is a long ways off, so he has no excuse as far as why he's not in Washington, D.C., voting on important issues.
And he's got the war chest, too, so he doesn't need to be here raising money.
Kind of break it up a little bit. I just wanted to call and tell you I really do appreciate you coming in, and I think it's going to be a bright future for labor radios to have you have the addition of you on the show.
Well, I hope so.
I want to thank you for participating.
A little bit of a rocky start this morning, but I really appreciate you calling, Neil. Thank you.
Thank you. Bye-bye.
And that was Neil Miller. He brought up a couple of things I'd like to expand on. He talked about the Medicaid expansion money. We only just barely touched that, but we've talked about that a lot of times here already. That money would take care of folks who are working but can't afford insurance. It would take care of most of our uninsured. And Medicaid is insurance, folks, don't forget. And it would, for no more than 10% of the cost of that would ever be borne by the state. The state is already spending billions on Medicare every year, and this is Medicaid, excuse me. This is a way to better leverage those funds and to keep more providers in the system that will take the Medicaid funds, because we'll be able to do something with the reimbursement rates, I believe. It's good for society to have a healthy populace. You can't work if you're sick. You can't go to work if you can't send your child to school because they're sick and you can't get treatment for them. It is to take care of folks who are up to 133% of the poverty level. We're not talking about rich folks who just choose not to buy insurance. And we're not talking about folks who aren't working by and large, because a lot of them, or particularly if they're disabled, they already qualify, they're already on Medicaid. It is a way to insure more of our population, and I know I heard one legislator say that would take care of about 250,000 people in this state. That you may remember that I said earlier, and I read this in another article, about 300,000 of our citizens make under $15,000 a year. So most of those, believe it or not, may not qualify for Medicaid now, but would if we took the Medicaid expansion. Neil also mentioned our corporate welfare, our tax breaks and subsidies. I want to be careful in this area because, as I said, we need to know what we are paying for. Some of those tax breaks really have brought in good jobs to this state, and the thought behind those tax breaks has been that we would have more people working, and that the increase in income taxes from people working would more than offset the credits for businesses coming here. That's the theory, or at least a part of the theory behind tax breaks. Problem is, we haven't always kept up with that. We haven't gone back and made them prove that really we did get those jobs, and really that income is we really are employing Louisiana citizens who really are paying their income tax here. And when we look at those things, that's what we should look at. And I want to say it. The AFL-CIO and all of its member affiliate unions have been saying this for years. It started out with Better Choices for a Better Louisiana, which wasn't just unions but some other groups around the state. Kind of evolved into the Louisiana Budget Project, which is a nonprofit that examines in detail the budget of the state and where the money's coming from, where the money's going, whether it's one-time money or recurring money, whether it's one-time expenses or revenue or recurring, and so forth. And there has been a wealth of information that has been provided to legislators in the last few years about how we're spending our available dollars and how we've been doing it in short-sighted ways. I want to give some credit to that organization, Jan Moeller, with the Louisiana Budget Project. And I also want to say, whatever side of this equation you're on, you need to hear this. This isn't completely Governor Jindal's fault. A certain number of legislators has to vote on everything that comes through that big building downtown. And he has to convince them, whether it's through strong arming or because they are like-minded, that it's the right thing to do to get the votes that he wants. Folks, we got to work on the ones that you send to us to the Capitol. They're the ones whose feet need to be held to the fire, because the governor, although the governor of Louisiana is a super powerful governor, he can't do anything by himself. He has to get the votes. He has to get the votes from legislators, and if you keep the pressure on them, that's the way to do it. Inform yourselves. Arm yourselves with information. Neil also mentioned on these tax breaks, or I wanted to bring up something I read this morning, and I think it was a very provocative article, because I know the picture is probably bigger than this, and I actually would like to read part of it to you. The headline was, "If we put an end to corporate welfare, college tuition could be free." Before I go on, I'm going to point out to you that a number of European countries that I know of do have free college tuition. And I'm saying free, but it's actually paid for, because professors have to be paid and people who maintain buildings have to be paid, and so forth. Taxes paid by the people pay for public education all the way through college in those countries. So it's not free, but you go without charge, because the idea is that society is paying that bill because it is a value that society holds. So anyway, this article says that if we end corporate welfare, college tuition could be free. Since 2008, 48 states have cut funding from public colleges, some by as much as 40%. State lawmakers couch their decisions as the unavoidable consequence of the Great Recession and budget deficits. Is it really? What they fail to mention is that while they're gutting higher education, they're giving corporations tens of billions of dollars in tax breaks and incentives. Now remember, those same corporations, when they come to your state, want to know what is the education level of your populace. Do you have the skilled workers for me to run my business in your state? State, local, and county governments provide corporations with $80 billion in tax breaks annually. Did you hear that? $80 billion with a B. That's $9 million per hour, according to an investigation by the New York Times. Now, to put that number into perspective, total tuition at public colleges in 2012 was just under $60 billion. Total tuition, did you hear that? Tax breaks for corporations, $80 billion a year. Total tuition in all public colleges, $60 billion a year. And that's according to the State Higher Education Executive Officers Association. Tuition at four-year public colleges, which educate, that's the LSUs and the Southerns and the McNeeses and the Nichols and the Northwesterns and the UL system. Tuition at four-year public colleges, which educate about 76% of American undergrads, has been rising for the past 25 years. According to the Center on Budget and Policy Priorities, tuition has increased 28% since 2007. There are several factors why college tuition is soaring, but the main culprit is declining support from the states, which translates into higher out-of-pocket costs for students. Michael Leachman of the Center on Budget and Policy Priorities, that's CBPP, points to the perfect correlation between declining state support and rising tuition. If you look over the last 25 years, he says, per student revenue from state and local government, it fell by about $2,600 after you adjust for inflation. Over that same period of time, tuition increased by $2,600. So, in other words, the entire increase in tuition at public colleges and universities over the last 25 years has gone to make up for state and local funding cuts. If the states had not cut the money to the colleges, the tuition would not be going up. Now, I'm going to continue on this in a minute, but I want to recall that here in Baton Rouge, Southern is discussing combining some leadership positions to save funds. LSU is talking about maybe having to lay off thousands of workers in their system and cut out some courses and some programs. Okay, so this is what's going on. So in 1987, students paid close to 20% of their tuition. Now students pay close to half. Okay. Defunding education to pay for corporate tax breaks is dubious economic policy. Mark Zandi, chief economist of Moody's Analytics, estimates corporate tax breaks generate 30 cents in economic demand for every dollar spent on the tax cut. By comparison, investing in education generates $1.50 for every dollar spent, or about 5 times more effective than corporate tax breaks. Now, this is one group, Moody's Analytics, that says this. So remember, corporate tax break, we get back 30 cents on the dollar. Investing in education, $1.50 on the dollar. Seems like that should be a pretty obvious choice to me. Now, we do have to balance that, as I said before. We want the businesses to come. We want them to prosper because they can't share their prosperity with workers unless they are prospering. But are we supposed to pay for that? I don't know. So here's something that makes it a little bit more local. Louisiana Governor Bobby Jindal has called for shared sacrifice in tough times. Here's a quote. We are facing back-to-back years of projected budget deficits and declining revenue. Every part of government must cut back. We must all share in the savings as we work to protect critical state services, he stated on his website. But an examination of Jindal's budget reveals the burden isn't being shared at all. Since Jindal took office in 2008, support by public colleges has been cut by more than $5,000 per student, the largest in the nation. Louisiana's investment in higher education is now the lowest since the 1950s. 60-something years ago, folks, the lowest investment in public education since the 50s. Over the same year, Governor Jindal gave corporations more than $11 billion in tax breaks at a cost of $2,500 per resident. Here's where I'm going to point out that this article needs to say Governor Jindal and the legislature, meaning certain legislators, gave corporations that $11 billion. The cost of this is $2,500 per resident. That's man, woman, and child, folks. Oil giant ExxonMobil, which they are a good partner, they're a good employer, but they received a $263 million tax break, which amounts to 97% of the total subsidies received by the company from all 50 states. The money that states give Exxon, Louisiana provided 97% of it. 97%. Governor Jindal's single gift to ExxonMobil is almost equal to the $300 million in additional cuts to public colleges he announced in January. Do you have bells ringing yet? If the cuts pass, Louisiana State University could see thousands of teacher and staff layoffs, departments and campuses closed, and the future competitiveness of the school severely compromised. And that's just one school, folks. As I said, Southern has been in extreme circumstances for a while. They've always been underfunded. We do need to do something about that. Now, we're an extreme example, but we're not by ourselves. Arizona has witnessed the nation's second largest cuts to higher ed since 2008. During that same period, their lawmakers slashed corporate taxes by 30%, or about $270 million. They gave back $270 million to businesses while they were cutting higher ed. South Carolina was third, and while Governor Nikki Haley there has overseen an 800% spike in corporate welfare. Surely you have something to say about this. Our call-in number is 343-1075. My kids, my grown kids, are 26, 27, 31, and 32 right now. I have 3 of the 4 are in college on their own, couple in graduate programs, and one working full-time and in an undergrad program. So they're bearing the cost of that tuition, and through sacrifice, because that's the way you do it. But they all have good jobs, already, so they're able to do that. Good morning, caller. You're on the air.
Good morning, Julie. How are you?
I'm doing just fine, Mr. Stevens. I caught your attention with something, huh?
Well, you did, Julie. We talk about the bad practices and the decisions that our illustrious governor has made, but we've got to realize he's only one person.
Uh-huh.
We've got a legislature, we've got a state senate that sit by, for the most part, idly and let these things happen.
The headline in this morning's paper was about mostly they just went along with the cuts he was making. Nobody proposed anything different.
That's right. And my thought this morning was just to remind your listeners that this fall we have the opportunity to change that. Every seat in that legislature and in that Senate is up for re-election. Some are term limited and won't be coming back.
Unfortunately, some of those are some of the really good ones. Some we will not be sorry to see go.
Right. And look, some will be sorry to see go, and some we need to take a close look. If you look at the proposed closure of the emergency room at the Baton Rouge General, we've had some good friends to come out and be on the forefront to say this is wrong. We shouldn't do this. But you've got some here, right, in the city of Baton Rouge that haven't said one word about it.
Haven't raised their head, and they also represent people who use that facility.
That's right.
That's right.
We were in Alexandria yesterday and talked to some folks over there. We actually met with former Representative Herbert Dixon.
Mm-hmm.
And one of the things that was said there yesterday when they had that problem with the hospital in the Alexandria area, there are 3 representatives in that area,
Herbert Dixon fought like hell to try to avoid what was going to happen over there.
Mm-hmm.
The other two didn't say one word, but it's all Herbert Dixon's fault because it's closed.
Well, he's probably the only one anybody had any access to.
That's right.
Yeah, but, you know, there again, it's on us as the public. Access to the people we elect. You got to call. You got to show up at their offices. You have to email. You have to, you know, we can testify to this, you and I, Ernest, because we've been at the Capitol when 600 people in bright green shirts show up and how much of a difference that makes. You know, we need to do our part. It's not just about going into the voting booth. That's where it begins. Well, it begins with education about who you're voting for. But after you vote for someone, they get elected. Now what? Do you just expect them to be like an unsupervised 2-year-old?
Well, you got to hold them accountable. And when they look up from that, and they're in that legislature and that committee hearing, and they look up and see the folks from home, it makes a difference in the way they think and the things they do, I can guarantee you.
Yeah, I noticed on the news last night the person who was interviewed from the public, a woman who's been waiting for disability waiver services for her child for years and years and years. But she shows up. If more people from the community show up, tune in, call their legislators, you know, we can make the difference. First, we have to elect the right people, but if we make a mistake and we elect the wrong people, we can make it darned uncomfortable for them to continue to do the wrong thing. Am I right?
You're exactly right, Julie, and we've seen it before that's what it takes. You talked about those T-shirts. When those folks can't move around the halls of that legislature because folks from back home are there telling them, this is what we want, it makes a difference.
Sure, and a couple of years ago, some people were trying to say you couldn't pick your own doctor if you got hurt on the job. You know, and they want you to go to the company doctor. They called those legislators' offices. They called the Capitol. We had people at the Capitol asking us, please tell your people to stop calling. Because, you know, one of the first things we should be able to do in this country is choose where we go. We should have access to health care in this country, and we should be able to decide where we're going to go for our health care.
That's absolutely right. That's absolutely right.
And, of course, we always tell them, no, we're not going to tell them to stop calling. Not till you do the right thing.
Well, it makes a difference. And, again, I said, I just wanted to call in this morning and remind the listeners that this is our chance this fall. If you're not satisfied with what's going on in the legislature, look at your legislators' voting record. You decide.
Right.
My
and
representative is not going to be able to run again. Who do I want to represent me? My representative is running again. But what did he do to help me?
What have you, right.
You don't have to listen to what I say.
Right.
It's your choice.
I have said that many times on here, too. Don't take my word for it, and don't listen to a 30-second soundbite. Please don't let that be your only source of information. Arm yourself with information about whether this person is working in your best interest or not, and if they're not, who will.
That's right. You know, I've always heard that the mark of a great leader is the person that he or she surrounds him or herself with. If you look at, I won't call him a great leader, but you look at the leader we have in this state and the people he surrounds himself with, and it says a lot. You know, we don't get what we should have because they don't really care about us. They've got theirs, and that's it.
Right, right. But you're on elections. You know, if you're not registered to vote, you know you can do that year-round. You don't have to wait till it's almost too late to register to vote. And you can register at the driver's license office. You can register to vote online if you have a driver's license. Did you know that? You provide information online pertaining to your driver's license. That means the state has already certified your identity, and you can register to vote online in this state. That is one place where we are progressive in this state. If you don't have a computer at home, guess what? The public library can help you do it. We have all kinds of resources to vote. So first, if you're not registered to vote, shame on you, and do it, you know, as soon as you can. Second, the only vote that doesn't count is the one that isn't cast. So go to the polls when it's time, and go every single time. Make your voice heard. And third, after you have voted, pay attention to what's going on and who's doing the job and who we need to fire.
You know, another thing, Julie, on the voting piece, we need to start bringing our kids along. You know, the kid can actually vote. A high school senior, not vote, can register to vote.
Before they're 18.
Before they're 18, he can't vote until he makes 18, but he can register to vote at 17, provided that he makes 18 before the first election that he's eligible to vote in. We need to start our kids voting and make it a habit. I hear Dr. Johnson use the word become a chronic voter. You become a chronic voter, and it's almost a habit.
Right.
You're looking forward to an election that you can get out and go vote. I mean, that's what it's all about. If we register every day, all day. But if we don't get out and vote, the registration didn't do any good.
That's right. Absolutely right. And, you know, it is a process. Those are the pieces. But it's easy to register in this state. Shame on you if you haven't done it. Call our office. We have some cards in the office. Call, you know, whoever you can think of to call. If you can't get out, I'm sure there's an organization that serves you. There are folks in this town who that's what they do. Get involved in some of the organizations in town that help people make sure they get out to vote. And we have a number of them here. So, you know, I know we beat that drum a lot, but we need people registered and we need them to vote. We need them to be chronic voters, as Dr. Johnson says.
So, Julie, look, again, I want to say y'all are doing a wonderful job with your radio show. You bring some good ideas and very pertinent information to you listeners. I'll tell you to keep up the good work, and you have a good day.
You too. Thank you for calling.
Okay. Bye-bye.
Bye-bye. And that was Ernest Stevens, who is the president of the Baton Rouge AFL-CIO Central Labor Council. This program, Baton Rouge Labor Radio, is brought to you by the Louisiana AFL-CIO and the Baton Rouge Building and Construction Trades. Baton Rouge Labor Radio airs on WTQT 106.1 FM. If you are in an area where you can't tune in, we are also streamed live. And Baton Rouge Labor Radio has a Facebook page. We'd love you to check that out and like us on Facebook. And you know, we do a lot of work in this community. I guess that makes sense since we represent working people. But we don't just do carpentry work and sheet metal work and electrical work and teaching school and policing and firefighting. We work in the community in other organizations, too. I know a young lady who works with the teachers who's on the board of the Girl Scouts. I sit on the Volunteer Louisiana board and on the board of the Louisiana Educational Television Authority. I think Lewis has represented folks on the task force on the working uninsured, those folks we're trying to get covered by Medicaid. All of us, we have a gentleman with the Plumbers and Pipe Fitters who is a nationally recognized volunteer with the Red Cross. We believe that the things we do make our communities stronger and more vibrant communities. You have to jump in the pool and get your feet wet to do it. You have to get involved with your neighbors. You have to recognize your neighbors as a neighbor. You know, we're fortunate to be airing on a gospel station here. That's the normal programming with WTQT. And I like to think of it this way. Someone asked Jesus about what was the greatest of the commandments, and Jesus answered something, I'm paraphrasing, of course. The greatest command is to love God with all your being. The second one is like the first, to love your neighbor as yourself. And then the question was asked, who is my neighbor? And Jesus told the story of the Good Samaritan. The point of the story, for those who are not gospel historians, but the point of the story was the person that turned out to act like a neighbor was a hated person to the Jews. The Samaritans and Jews did not get along. They hated each other. Yet all these high-level Jewish people just passed by the person who'd been beaten by robbers and had everything stolen. and the Samaritan is the one who stopped and helped him. Folks, everybody is your neighbor. That's what Jesus was saying. He didn't say just people who look like me, just people who believe like me, just people who go to the school I go to the church I go to, believe like I do. His point was we need to recognize our neighbor in each other, and our call is to love everyone. For me, that is union work is the gospel in action. I know a lot of people don't feel that way, but it's a way that I live my faith. We work to make our communities better, and we work to recognize the face of Jesus in everyone that we encounter, and that's what makes them our loved neighbor. So I was telling you a little bit about corporate subsidies and how that has completely, if this very provocative article said if we got rid of them completely, all our students could go to college, to public colleges and universities tuition-free because we'd be paying for it other ways. That is probably too simple. We all know if there's a pot of money out there, there's going to be fighting over how it gets spent. But it has been deemed of value in some other countries, and their students get to go to college, the ones who qualify, I'm sure, without paying tuition because the debt is paid by society because society values that. So if states were to redirect corporate tax breaks toward higher education, it would essentially make public undergraduate and graduate colleges in the U.S. tuition-free. The only obstacle is convincing politicians to support students rather than their campaign contributors. It's no accident, folks, that those corporations that give tons of money to get people elected get something back for what they paid for. Guess what? They don't walk into the voting booth and push the button. You do. Exxon can't walk into a voting booth and vote for any politician in any race. You can. That's back to beating that same drum. Register to vote, and then hold your elected officials accountable, and that's how it's done. And it's a process. It doesn't happen overnight, and you can't turn your back. You have to pay attention. Someone may do something that you love sometime and then sneak something in somewhere else, and that's part of how politics is done, unfortunately. It's not always very pretty, but that is how it's done. With that, I thank you for listening, and I thank those who called in to kind of give me a little bit of a break. As I said, this is the first time for me to do this by myself. It's been really, really easy doing it with Neil and Mike, and Ernest and Lewis have dropped in, and, maybe I'll hopefully prepare something for you a little bit better the next time. And with that, I would like to close with something that I really love to listen to if I get it to work, a really beautiful rendition of Wade in the Water by as sung by Eva Cassidy, and she's got a gorgeous voice, and I hope you enjoy it. This is Baton Rouge Labor Radio. Julie Cherry, thank you for joining us.